Obstructive sleep apnea syndrome, osas. This is prolonged partial obstruction or intermittent sort of complete obstruction, interrupting the sleep, interrupting the normal ventilation of a person. It is due to the tonsil adenoid enlargement, commonly repeated infection and hypertrophy. In children, it is more common in 2 to 6 years old child because this age group has higher amount of tonsillitis. It's common in all the group, even adult. So apart from that, you have septal deviation, you have cystic fibrosis, uncommon disease, coronal atresia, you have chronic rhinitis, obesity, Picquickian syndrome, and you have mandibular hypoplasia, as you see in plenty of syndromes like Pierre-Robin's and Down syndrome. You have hypotonia, you have pharyngeal wall collapse. So these are the causes. How do they present? They present with the nocturnal dyspnea. The night symptoms are apnea, mouth breathing, snoring, restlessness, and repeated sleep interruption, awakening in the sleep, and you have your upper torso sweating and hyperextended neck during sleep, nocturnal enuresis. The daytime symptoms are excessive sweating, early morning headache, and little bit of behavioral disorders like ADHD, and your a little bit crankiness, tired, fatigue because the child didn't sleep in the night, and then learning difficulties, school failure is possible, and they also have the medical problems like recurrent pneumonia, chronic nocturnal cough, and there can be little bit of less calorie intake and your failure to thrive. These children can have adenoid and orthodontic malformations, and you have hyponasal speech and swallowing difficulty at times. Upper respiratory infection including otitis media is more common in these children. So diagnosis of the osas is the overnight polysomnography. More 1.5, more than 1.5, your diagnostic, an X-ray PNS might show your adenoid enlargement. How to treat? You can try a little bit of underlying cause dealing. For example, your intranasal steroid spray for a couple of days, weeks, and months as it is needed, but the sleep surgery or your adenotonsillectomy is maybe the definitive curative in 85% of cases, and so the ENT people do it. So and a little bit of the exclusion of the other, obesity reduction, and then you can have some complications like neurocognition impairment, ADHD, and school performance slow, and sleep interruption leading to your somnolence at times, the rest of the time sleeping more, pulmonary hypertension, your nocturnal enuresis, systemic hypertension, even core pulmonary is more common, pectus deformity, and gravest one is the respiratory failure. And hypertension is very important, one of the diseases, and now we do fail to recognize it in the last couple of decades.